Hi, I am Dr. Praveen Kumar Yam, Rheumatologist at the Arthritis and Rheumatoid Center, Nagarbavi. So today I will be briefing you about a diet in a rheumatoid arthritis or arthritis in general. Like what has to be taken, what has to be avoided, and the exercises and the healthy tips in rheumatoid arthritis. So let us come to what has to be taken. So this is the commonest question I encounter in a day-to-day practice from the patients. Like what diet they should prefer. I suggest they should take a healthy diet which is rich in antioxidants, which contains green leafy vegetables and all the types of the fruits and minerals. So they can choose a low carbohydrate and low refined foods with adequate amount of the fat and the protein. So what has to be avoided? There are certain foods which triggers the inflammation or triggers the joint pains, which is like in a vegetarian food, it's a potato, brinjal, paneer and sprouts. So these foods can trigger the inflammation. So in existing arthritis patient, so these has to be better avoided. So in the non-vegetarians, what has to be avoided? So red meat is the known culprit. It can trigger the symptoms, so it has to be avoided, and chicken as well. So if you avoid red meat and chicken, what else is left? Then fish can be taken. So it contains a high amount of the omega-3 fatty acid, which is known to act as anti-inflammatory. Fish consumption can be taken. This is about the diet. And another most important thing, most of the patient they will hear about these supplements, especially the protein supplements, the immune boosters, milkshakes, so many things, either to the advertiser, through their neighbors, or someone would tell them that taking this medication or these supplements will reduce the joint pains. But absolutely these are all baseless, and there is no proof that taking these supplements will reduce the joint pain. So I would never recommend patients to take protein supplements until unless they are very malnourished, nor the immune booster, nor any other milkshake or any other supplements to enhance their immunity. It's absolutely a wrong concept. So that should be avoided. So coming to the exercises. So most of the patients they will ask, like when they have a joint pain, how can do exercises? It will be hurting them, and true. So we definitely not recommend the patient to do exercises during an active phase. So what exercise we recommend is that doing a stretching exercise. What we do it in our school days, in our PT time, we used to do the stretching exercise like the hand movements, or the elbow movements, or the shoulder, or the knee. Those stretching movements are help to keep the joint in a mobile condition or in a functional conditions. And definitely they should avoid a muscle strengthening exercises which they do in gym. There is no need to strengthen your muscles, because whenever you put weight in any joints, it is definitely going to hurt. They can definitely do it when the disease is stable, but as such it is not required or recommended. And most important is that the exercise which you have to do it in a day-to-day basis is the brisk walking. WHO, which stands for World Health Organization, recommends 30 minutes of brisk walk per day for 5 days in a week. So what is brisk walking? It's not just a normal walking you usually do in a park. Brisk in the sense, when you complete that activity, you will have a fatigue or a sweating or a shortness of breath. So if you follow this brisk walk of 30 minutes duration per day, it will be sufficient to keep your body health and also to keep your weight in an ideal condition, and along with the diet restriction. So overall these are very helpful in combating the inflammation and also your maintaining a healthy body. What other supplements you can take to reduce the inflammation? There is a scientific evidence to suggest that supplementation with ginger and cinnamon, either with hot water or a coffee or a tea or milk daily, so it can reduce the inflammation. And most of our patients ask whether they can take coffee, tea or milk product, dairy product. So actually these food will usually not aggravate the joint symptoms. So there is no harm in taking the coffee, tea or milk products or dairy products as such. So other health tips I would like to give is about during winter. So especially the cold weather is known to exacerbate the joint symptoms. You should cover your body with sweaters or gloves and socks, so to keep the body warm. So the temperature is the one which plays a crucial role in joint symptoms as well. And also you should keep yourself hydrated during the winter and summer. During the winter, you should avoid getting up early from the bed because the cold weather can exacerbate the joint symptoms. Thank you.